Hello everyone, this is Kevin Kruse here with Kruse Orthopedic Associates in Dallas, Texas. We're a division of Lone Star Orthopedics. Here today talking to you about shoulder surgery and some of the reasons why we use the devices and implants that we use in shoulder surgery. So if you've made the decision to have your shoulder replaced because of severe pain due to arthritis or a rotator cuff tear, the next step we talk about is replacing the shoulder. And again, we've talked about there's two types of shoulder replacements. Some patients I know right off the bat which type I'm going to use, but very often I don't know the type of implant I'm going to use, whether we're going to do the standard anatomic shoulder as opposed to the reverse shoulder, until I sit down on a computer and I map out your surgery. And there are a lot of different factors that we take into account when we're trying to make that decision. A lot of it has to do with the status of your rotator cuff. It has to do with the wear of your socket and your glenoid. And this is all very new in orthopedics and in the shoulder world, and it's really a moving target. And the data is coming out every single year. We're fine tuning our indications. And where I trained in France, I was very fortunate to train with who I feel is one of the foremost shoulder surgeons in the world, and the guy who's really on the cutting edge of doing the studies and the research to try to figure out which patient we should put in which implant, and also the surgeon who really was at the forefront of using 3D mapping and computer navigation to help us put these implants in a more accurate way and also make decisions about which implant to use. And so for me, I have never not used a computer to map out a shoulder surgery. I've used it. It's a huge part of my practice. And so for me, being able to get a CT scan of your shoulder and to sit down on a computer and really map out the operation, it's integral to what I do. So once I do that, I'll be able to make the decision. We'll be able to tell you before the operation which implant we're going to use. The company that I currently use is Arthrex. The reason why I like Arthrex is because of some subtleties of their implant design. They have a really nice computer navigation system that allows me to map out your shoulder. They have a guide that's a 3D printed guide, or 3D guide that's used on the computer to basically take what we did on the computer and put it into your shoulder exactly like we mapped it out on the computer. So I tell everyone it's really a customized implant to your shoulder. We can put everything in exactly like we mapped it on the computer. It's very, very accurate surgery. Cuts down a massive amount on our operation time. Our typical total shoulder time, skin to skin, is 40 to 50 minutes, which is very, very quick. And a lot of that is because we've mapped everything out beforehand on the computer. There's no guesswork, there's no trialing, there's no templating the operation. We know exactly what we're going to put in. The reps in the room know what we're going to put in. The scrub techs know. And when we go into the operation, we're just putting everything in. And we very rarely deviate from our plan. I like Arthrex's computer system. Their guide is reusable, so I don't have to wait several weeks to get their guide, which is something unique on the market. They also have a lot of different implant variability, which allows me to do the majority of the operations I need to do in the shoulder. The other thing I like about Arthrex is for their standard shoulder replacement, they have a stemless shoulder that essentially allows you to do the standard anatomic shoulder without putting a stem all the way down in the humerus. So you're taking away less bone, you're getting a more accurate recreation of the anatomy. And their stemless implant has actually been on the market longer than any stemless implant in the world. It was first brought into the market in Europe almost 15 years ago. So it's got the longest amount of follow-up of that newer shoulder implant that really has only started taking off in the United States in the last 2 to 3 years. So they have a really nice portfolio of products that allow me to treat 95% of the shoulder pathology that I see when it comes to joint replacements. They've done a really good job so far.